Welcome, everyone. Good morning. I am Larita Clark, the Chief Executive Officer of the Metropolitan Pier and Exposition Authority, better known as MPEA. We own and operate McCormick Place, North America's largest convention center, the Wintrust Arena, Hyatt Regency McCormick Place, and the Marriott Marquis Chicago. I'm very pleased to be joined here today by my colleagues, David Costin, General Manager of McCormick Place, David Kennedy, Assistant General Manager for Entertainment, along with Karen Harris, Senior Vice President and General Counsel of the Illinois Health and Hospital Association, Brenda Battle, and Dr. Anzo, also of the Illinois Health and Hospital Association. Peter Illman joins us from the Association for Manufacturing Technology, and joining us remotely will be Steve Drew from the Radiological Society of North America. While they could not be here with us today, I would also like to thank both Governor J.B. Pritzker and Mayor Lori Lightfoot, who have been and continue to be wonderful working partners for the MPEA team. Since March 2020, McCormick Place has been closed, and nearly all of our workers have been furloughed. It felt unlikely that we would ever return to normal throughout much of the pandemic, and seeing our employees struggle has been gut-wrenching. But I am here today at our new ACT hybrid production studio powered by Freeman to let you know that McCormick Place is well on the way to reopening soon with a robust schedule of events through the end of this year and a full schedule of events in 2022 and beyond. I'd like to touch on a few things today. First, I'm happy to announce that the Marriott Marquis Chicago will be reopening to private events this June and to the public in July. The Marriott has been closed for more than a year, and we are thrilled to have it reopen. It was a difficult decision to close the hotel, but now we feel complete again with the Hyatt Regency McCormick Place and the Marriott Marquis Chicago, both welcoming guests. The timing of opening is directly connected to the Wintrust Arena. As you may know, this past Sunday, the WNBA's Chicago Sky, who is an anchor tenant for the Wintrust Arena, were able to play to the sounds of fans cheering. We are so happy to have the Sky on campus, and even happier now that we can cheer them on in person. In addition to the Chicago Sky in June, we will also welcome the NBA Draft Combine. They will be using the Marriott Marquis and the Wintrust Arena. But this is just the beginning. As you all know, earlier this month, we announced the Chicago Auto Show is returning for a special summer edition. We are also thrilled to share that July will kick off with Nike Tournament of Champions from July 10th through 12th, followed by Advertising Specialty Institute, known as ASI, from July 13th through 15th. This is welcome news for many reasons, but most importantly, it shows how far our city, our state, and our country have come in the fight against COVID. McCormick Place's commitment from day one has been to act in the best interest of public health. But we are also acutely aware of our mission. Our mission by state statute is to attract trade shows, conventions, meetings, expositions, and public events to strengthen the economy of Illinois and the region at large. And McCormick Place is ready to do that. The meetings and convention industry is extremely competitive. And with COVID, it has become even more competitive. But McCormick Place is well positioned to compete. We increased our abilities in hybrid event production to ensure that McCormick Place thrives in this post-pandemic world. This studio that we are in today, the ACT Hybrid Production Studio, powered by Freeman, has Hollywood-grade technology to ensure that while events are on campus, we also can share special and creative hybrid events around the world with global audiences. I'm going to ask David Costin and David Kennedy to speak on that in a few moments. The team here at McCormick Place is always constantly innovating and looking to ensure that we are creating the best possible experience for our clients. An ACT Hybrid Studio adds the flexibility and state-of-the-art approach to meetings and events. During the 14 months that we've been closed, we've made significant health and safety improvements on campus, resulting in the entire campus having GBAC Star accreditation. This means that we are more than well prepared to ensure that our employees and guests remain safe while at McCormick Place. Working with Choose Chicago, we created a website, Healthy Meetings Chicago, to help our guests understand what to expect when they come to McCormick Place. Launched in January, we are updating it periodically to reflect changes in public health guidance. Now, looking forward, between July 2021 and December 2022, there are 122 events scheduled at McCormick Place, with an estimated attendance of 1.9 million. Of these, 47 events are considered to be major events, with an estimated economic impact of $2.3 million, and estimated hotel room nights at 1.2 million. Notable events include Retail X, Sox Fest, Chicago Boat and RV Show, Midwest Clinic, C2E2, Experiential Marketing Summit, National Association of Convenience Stores, True Value Reunion, the Water Environment Federation, and the Chicago Dental Society's Midwinter Meeting. But there is more. We also have the National Black MBAs, American Society of Radiation Oncology, Chicago Marathon Health and Fitness Expo, Process Expo, Society for Neuroscience, International Manufacturing Technology Show, Radiological Society of North America, Midwest Clinic, and Muslim American Society, just to name a few. And we're bringing back events that left Chicago, but are returning next year because McCormick Place is open, including the very popular Sweets and Snacks Expo, which I like to call the Candy Show. It is important to note that these are confirmed events. Working with Choose Chicago, our campus sales team has been extremely busy and have dozens of active prospects. These developments are not only good for McCormick Place, but that means the return of much needed jobs. We are beginning to call employees back and estimate that by July, approximately 937 FTEs will be restored, increasing to 1,104 in January and 1,729 by June of next year. These are direct jobs. We know from past economic impact studies that for every 10 jobs directly attributable to McCormick Place, to McCormick Square campus, an additional 5 jobs are created in the state economy. And the numbers may change as we continue to confirm new business. McCormick Place events hire, either directly or through contractors, skilled labor that work approximately 3.9 million hours on campus per year. The 3.9 million hours is fulfilled by approximately 8,000 to 10,000 individuals that have not worked on McCormick Place campus over the past year. These are also people who will be returning to work as we reopen. Our campus has had some amazing moments over the years, including visits from presidents and countless notable events. Still, today is also very special because it means the return of many of our colleagues to this campus. McCormick Place is not only well-positioned to compete post-pandemic, we are moving forward with complete confidence that McCormick Place will thrive. Our loyal clients want to return to McCormick Place, and everyone at MPEA could not be any more excited to be back in business. And with that, I will turn it over to my colleague, David Costin.
Thank you, Larita. It is a great day here for the city of Chicago, state of Illinois, and particularly McCormick Place. We are very, very excited to be here today to talk about reopening, coming back, doing all of the things that are so important for our city and state, but also to talk about this new offering that we have that we want to share with you. But before I do that, I want to just go off script for a minute and just thank Larita Clark. I don't know where Larita Clark went. She's over there. But Larita, as the CEO of MPEA, has led all of us through this pandemic. And quite frankly, without her leadership, we wouldn't be here today. So on behalf of all of us on the staff, our partners that are here in the room, we really want to thank Larita for her leadership in getting us to where we are today. I know we're here to talk about this new offering, and I do want to do that, but I do want to just say that there are three things hopefully that everyone walks away from today's event knowing. One, we are confident about coming back to business. We are confident because we've followed the science. We're confident because we know our health officials at the city and state have steered us in the right direction. We're confident because our customers are ready to come back. And we're confident because we know that here in the facility, we've done everything to position ourselves to be ready to do that. The second thing, and I can't say this enough, we really want to welcome everybody back. It's so important for us to welcome everyone, our organizers, our exhibitors, our attendees, our contractors, and everyone that makes up what McCormick Place is, a place to do business, a place to have opportunities to sell, to share, to network, to do hard science, to bring people back to network. All that is here in this facility, and we're so happy to welcome everybody back. And then the last thing that we learned over the last 14 months is that we need to continue to be flexible. We have to be able to change. We have to be able to see what is on the horizon, and really that's what it is we're talking about today. So we talk about hybrid events and we talk about virtual events. For the last year, our customers have been doing virtual events. Hybrid events are a little bit different. They're an interactive experience. And we see that opportunity here with what we're doing at the Erie Crown Theater, because we can have an audience. We can have interaction. And what you'll see in a moment, we can have live streaming coming from another part of the state, bringing people here. We've invested a lot to have the proper infrastructure and backbone, and then partnering with Freeman, we've been able to bring this technology here and make it available to our customers moving forward. But I would be remiss to say that we haven't been thinking about this for some time. And we've looked at the opportunities for what hybrid means. And we understand it really, quite frankly, when we opened the Wintrust Arena a couple of years ago, that Larita talked about the fact that we now have brought customers back into the facility for games. We had another game last night. We have there in that facility a broad production capability. We televise from that location. So my point would be is if you were flying into McCormick Place or flying into Chicago over the lake, either Midway or O'Hare, you look down and you see the beautiful skyline of our city, and then you see the footprint of McCormick Place. In that northwest corner of that footprint is the Wintrust Arena, and it has that capability to provide production for large events. We've done esports gaming. We've done live events in conjunction with things occurring here on the campus, and we do sporting events. If you go in the middle of the campus, the 301 East Cermak, there's a new offering that we've worked out called the TAP, which is sponsored by Xfinity, I'm sorry. And that particular facility is kind of a different look, a different slant, more smaller, intimate, kind of in a more new way of doing business where people are sitting around in an environment where they can still do the streaming with a large screen. They have the ability to change the lights in that facility. And if I were there today, it would all be yellow for sunshine because we're letting the light in and we're excited about everything that's happening here in the facility. And then finally, we get to where we are here in the Erie Crown Theater. Why is this important? Because we can bring people here to the facility, allow that interaction to occur while you're here. So we're going to talk more about the technical details of this studio right now. I'm going to introduce David Kennedy. David is as already has been said, runs our entertainment division here at McCormick Place, and that includes this theater and the Wintrust Arena. So he's very, very familiar with the capabilities of what a hybrid studio should be and what we're hoping to achieve. So I thought maybe have a little bit of fun, David, if I could. I'm going to just sort of do this like a Jeopardy question. So this is the final Jeopardy question. Hopefully you'll get the answer right. Where can you find a state-of-the-art HD studio with a 26 by 15 LED wall? Try to figure it out, David.
Good morning. What is the Erie Crown studio powered by Freeman at McCormick Place? Hybrid, all of the above. Thank you, Dave, for the introduction. It's truly terrific to know that we're headed in the right direction and looking at a very busy event season coming up, both on campus. As you mentioned, we haven't been around for 14 months, but who's counting? It's good to know the suit still fits for many of us, that back to work and exciting. As you and Larita both mentioned, we have tremendously loyal customers here at McCormick Place. And I think that says a lot about our team and the work we do here across this campus. I'd like to take a few minutes to tell you about the room that we're in right now. And millions of visitors throughout the world have visited the Erie Crown Theater since it opened in 1960. It's very exciting. We've had some of the biggest names in entertainment on this stage. It's pretty incredible to think that the likes of Sinatra and the Supremes and the Rolling Stones and Simon and Garfunkel and Cedric the Entertainer and Tyler Perry landed his feet here and made him his name. Ray Charles, Neil Diamond, Jennifer Hudson, the list goes on and on. So we're very excited to be here. The theater will continue to be used for traditional events with many of our shows that are coming back, but we'll also have the wonderful hybrid production studio powered by Freeman, as you see behind us. There's over 4,000 seats here in the theater, and we've added a state-of-the-art technology specifically for the hybrid events that David had mentioned and the experiences. It has a truly impressive 400 square foot video wall and the ability to host the events in the theater as well as worldwide simultaneously. And I can assure you that for the past 14 months, when we've had our standard Zoom calls and Teams calls with the one camera, we've got the technology to have multiple cameras and have multiple capabilities of streaming that out and getting people involved both here and across the globe. The studio has incredible technology and capabilities to capture content using virtual environments, augmented reality, and so much more, all while streaming our content worldwide and bringing the live streams for guests. We look at the ACT Hybrid Production Studio powered by Freeman as an extension of what McCormick Place brand is known for, and that is flexibility. This place is very flexible. We have had the team here easy to do a one-day shoot with simple graphics or host events with Hollywood production value, including multi-camera, multi-day shoots, all with full rehearsals, complex graphics, and the highest production support. I've confirmed all of that with my teenagers. When it comes down to it, the studio and the expertise of our production partner, Freeman, can truly do anything. The sky is the limit, and we are pleased to add this to McCormick Place suite of offerings and look forward to customers use it moving forward. As soon as tomorrow, this incredible studio will be hosting the Choose Chicago annual meeting. And in June, the ACT Hybrid Production Studio, powered by Freeman, will also be hosting the Illinois Health and Hospital Association meeting that will be connecting healthcare leaders from throughout the state with many of their attendees, both here and across the state. So needless to say, we're very excited to be here today, as well as to be coming back. So with that, I'm going to return the microphone to Dave Costin, who will mention some of our other guests here today.
Thank you, David. I'm glad you're getting assistance from teenagers, because that's the future. But quite frankly, we have three really important customers that are here today. One is our newest customer, and two are long-standing customers that will be joining us a little bit in a minute. But I'd like to introduce now the group from the Illinois Health and Hospital Association. As you know, they are planning their meeting here in June, using the facilities here at the Erie Crown Theater. So there are three individuals that are here representing the association. Karen Harris, who is the Senior Vice President and General Counsel for the association, Brenda Battle, and also Dr. David Ansel, who, when he's not with the association, is also with Rush University. So with that, I'm going to introduce Karen and have her come up and speak.
Good morning. On behalf of the Illinois Health and Hospital Association, I'm pleased to be speaking to you today here at McCormick Place's Erie Crown Theater, and even more pleased that we are partnering with the ACT Hybrid Production Studio powered by Freeman for our inaugural statewide Health Equity Action Day on June 18th. I couldn't think of a better venue to both celebrate the work that has already been done and the journey that's ahead of us as we continue to work together to advance health equity across the state. Although the COVID pandemic brought our nations and our states and our cities health disparities to sharper focus for many, for the Illinois Health and Hospital Association's over 200 hospital and 40 health system members, these issues have been an area of focus for a long time. The high prevalence of diabetes, of health disease, of obesity, and other chronic issues in Black and Brown communities, along with lower economic conditions, are issues that hospitals have researched, studied, raised up, brought to light, and attempted to address, both individually and collectively, long before the pandemic. During the pandemic, hospitals increased their efforts to combat the disproportionate impact COVID-19 was having on our most vulnerable communities. For example, last April, in response to the shockingly disproportionate impact COVID had on our Black and Brown communities, the city of Chicago established the Racial Equity Rapid Response Team. This team, which was comprised of hospitals as well as other healthcare providers, worked aggressively and in close collaboration with local leaders and partners to first attempt to slow the spread of COVID through prevention education and access to testing and care, and then more recently to address vaccine hesitancy and the equitable distribution of vaccinations. And now, as we begin to emerge from the pandemic, thanks in part to our hospital and healthcare heroes, hospitals will continue to collectively address these issues and make permanent, lasting changes to hopefully finally eradicate the disparities and create health equity. That's why we are hosting our inaugural Health Equity Action Day, a statewide day to encourage every hospital in Illinois to reflect and to take affirmative and concrete action to advance health equity. As Brenda Battle from UChicago Medicine will discuss in a moment, and thanks to our partners here at McCormick and the ACT Hybrid Production Studio powered by Freeman, through a virtual event the morning of June 18th, we will celebrate the work that's already been done and the journey ahead. Then following the hybrid event, hospitals across the state will engage in activities to further their health equity initiatives, including beginning to complete the Racial Equity in Healthcare Progress Report, an assessment tool for hospitals to measure their progress on health equity metrics, which Dr. Ansel from Rush University Medical Center will be speaking about in a moment. Although we recognize we will not be able to eradicate the decades of health disparities in a single day, nor will we be able to do it alone. The Health Equity Action Day symbolizes the hospital community's commitment to continue to work with residents, neighbors, neighborhoods, faith leaders, elected officials, and other healthcare providers to continue what's already been started, ensuring that all Illinois residents get the right care in the right setting at the right time. So thank you, and we hope that you'll be able to join us on June 18th for our Health Equity Action Day.
Hello, and thank you, McCormick Place, for hosting us. My name is Dr. David Ansel. I'm Senior Vice President for Community Health Equity at Rush, and proud to be here with the Illinois Health and Hospital Association and with U Chicago Medicine. A year ago, we were in the midst of a pandemic that brought disproportional hospitalizations and mortality to Black and Brown patients and communities. And then about a year ago today, we saw the brutal murder of George Floyd, and we all say his name. It really brought together to the hospitals and the other healthcare providers and community leaders who sat around the mayor's racial equity rapid response team, how important it was for us to collectively make a statement about health equity. And we published a statement last year on Juneteenth. It was in the Sun-Times and in this Tribune, that it's undeniable, but racism is a public health problem, actually a public health crisis, we said. That statement out of Chicago went national. Many organizations emulated it. But it was really important that we just not make a statement, that we measure our progress within our own institutions to achieving racial equity and justice for everybody who needs it. So it's very proud today to announce that we have a new progress report, and it's called the Racial Equity and Healthcare Progress Report. And it serves as a long-term accountability tool to document progress within our institutions, not just hospitals, but clinics, to achieving racial equity. And giving the unique collaborative element of this work, the Racial Equity and Healthcare Progress Report is a tool to promote collective improvement, not competition. So this is the first in the country like this. In this baseline assessment that we piloted here already in Chicago and really ready to roll out statewide is an opportunity to measure progress, understand provider and community assets in racial equity work, and outline areas for improvement for individual providers and the larger ecosystem. And together, providers in Illinois have the opportunity to dismantle systemic racism in a way that no individual provider could. Together, we are better. And the tool aims to highlight important progress that providers have already made, but also outline the work ahead and do it collaboratively. There's 5 guiding principles to this work. Number 1, we want to facilitate collaboration. 2, we're going to focus on high impact metrics that can make a difference. Number 3, we're going to mobilize to action, have improvement work start collectively. There's a baseline set of metrics, but it'll evolve over time, and all of us will be on an improvement path. It's going to center, number 4, center on racial equity. And 5 is going to promote organizational growth. The report card is broken up into 4 categories. Our people bucket, where we're going to look at our boards, our leadership, our employee teams, and say, are we practicing what we're preaching when it comes to representation and health equity? Our patient bucket has us looking at our patients and their outcomes and ask if we have a strong handle on those who we're serving and what clinical inequities exist across our institutions. Our third bucket has to do with organizational processes and procedures, our internal strategies and such. And the section will focus on our ability to measure our outcomes by race, ethnicity, language, but also sexual orientation and gender identity. Lastly, we're going to focus on our community because health arises out of our community. And we're going to ask what kinds of connections our organizations have with partners outside of our four walls. And we're going to be, what kind of work are we doing collectively with community-based organizations? This whole progress report is meant to move the dial on racial equity in healthcare. And our aim is to get all Illinois healthcare organizations to participate in this and then take it across the nation. And I'd like to end on these words of Dr. Martin Luther King when he was in Chicago in 1966. And he said, it's not unreasonable to think that if we can change the system in Chicago, we can change it anywhere in the country. And that's what we intend to do with this progress report. Thank you. And I want to introduce my colleague, Brenda Batto from UChicago Medicine.
Thank you, David. I'm really excited to be here today, and I have the privilege of explaining what the IHA Health Equity Action Day will actually be. Thank you to McCormick Place for inviting us. This is very exciting to be the first event in the COVID, coming out of the COVID phase. So I'm Brenda Battle. I'm the Senior Vice President for Community Health Transformation and Chief Diversity, Inclusion, and Equity Officer for UChicago Medicine. So last month, Governor J.B. Pritzker signed a proclamation declaring June 18th as the Illinois Health and Hospital Association's Health Equity Action Day, a day for all Illinois hospitals, healthcare providers, and healthcare professionals to reflect on the realities of health disparities and the actions they can take individually and collectively to improve health equity for all Illinois residents and communities. We are excited about this gubernatorial proclamation and the Illinois Hospital Association's inaugural Health Equity Action Day, which is scheduled for Friday, June 18th. This day was selected to coincide with Juneteenth, June 19th, the date commemorating the end of slavery in the US. So as a background, on June 19th, 1865, federal troops arrived in Galveston, Texas, to inform the African-American community in Texas that the Civil War had ended and that the Emancipation Proclamation, which had been issued more than 2.5 years earlier on January 1st, 1863, by President Abraham Lincoln, meant that they were and had been free for several years. This day, often called Juneteenth, is therefore frequently referred to as the final official end of slavery in America. On this day of celebration, June 18th, the IHA Committee on Health Disparities, the Subcommittee of Health Equity Leaders, and Governor Pritzker are encouraging every hospital in Illinois to take affirmative and concrete action to advance health equity by participating in this tremendous opportunity to advance their health equity agenda. Beginning at 9 a.m., the virtual program will both celebrate the work that has already occurred and serve to begin discussions on the journey ahead as we work together to advance health equity across our state. I am happy to be the MC for the event. The event will feature multiple opportunities for engagement. We will have our keynote speaker, Michelle Silverthorne, founder of Inclusion Nation, a national speaker, author, and consultant who will set the tone for the day. We will host a live panel, speaking of hybrid, which we're excited about, of individuals that participated in the racial equity rapid response team work over last year to tell the story of that work that precipitated the partnership with the Illinois Health and Hospital Association and their ownership of the racial equity progress report that David spoke about. We were thrilled that the commissioner of the Chicago Department of Health, Dr. Allison Awardy, will also be one of the panelists for that discussion. Following the panel discussion, Adam Colress, the Illinois Health and Hospital Association's Assistant Vice President for Quality, Safety, and Health Policy, will launch the Racial Equity and Healthcare Progress Report, the assessment tool for hospitals to measure their progress in health equity metrics. The audience will witness vignettes of the voices of patients, community members, elected leaders, and others expressing their own perspective on health equity. Finally, the event will conclude with a call to action by several members of the Illinois Health and Hospital Association's Committee on Health Disparities. The day will culminate with an afternoon activities in which we are encouraging members to engage in on your own afternoon activities. The IHA's online resource hub will provide suggested activities and resources for hospitals to engage in, or they can participate in their own activities. We are asking that you encourage participation among your C-suite, physicians, board, clinical and non-clinical staff, legislators, and community members, and that you look at the full resources on the resource hub of the IHA, which will include the afternoon activities. We look forward to engaging in a meaningful Health Equity Action Day as we continue to work together to effect real change to advance health equity across our state. Thank you.
Thank you, Brenda. This IHA event sounds exciting, and it looks like we're very pleased to have this be the first event that we're doing here in the studio. But I want you to know that while we're excited and flexible about the fact that we're going to do more hybrid events in the future, the core to our business is to maintain face-to-face meetings. That's what we're about. And I have two customers that are longtime customers of McCormick Place. The first is actually here with us on the stage, and that's Peter Eelman, who is the Vice President and Chief Exhibition Officer for AMT, the Association for Manufacturing Technology. They produce and sponsor and put together IMTS, which is the International Manufacturing Technology Show. It meets here in McCormick Place every other year. Chicago is their home, has been for years, and will be into the future. The great news is that this is one of the largest events that we host. It covers all 4 buildings on the campus. And Peter is here to give us some exciting news on where that event is as they start to plan and get ready for 2022. So with that, I'd like to introduce Peter Eelman.
Thank you, David. We are coming back. Let that wash over you for a few minutes. We are coming back. We've kind of made that statement at the International Manufacturing Technology Show since we thought we'd try things here in Chicago in 1947. We came and checked it out and said we liked it. And we've come back with our show for the entire time since. For myself, I had a great experience in the last 24 hours as we were preparing for this. I got a note from one of the staff here that is new and hasn't known me very long. And she gave me instructions as to how to get to the East Building and find this room. And as this is my 41st year in coming to this room, I was able to find it without too much trouble. And our members, our exhibitors will find it as well. We had to cancel our show, as did everyone else in 2020. We actually did a hybrid event during that time, and we learned a few things. We learned that hybrid can enhance your capabilities and enhance the potential of your show. We've learned over the past year and a half, as we've continued to do events on an ongoing basis, that about half of our audience for those events is folks who have not attended the IMTS show in the past. They are now excited to come to the actual event. So when people ask me, well, are trade shows going to come back? Are they going to be the way they were? I can say, not only do we hope they'll be the way they used to be, we know they'll be that way because we have that contact via our hybrid events. We are in contact with our customers and our exhibitors. In the next 2 weeks, we're going to be announcing the floor plan for our 2022 event. And that includes over 1 million square feet of space already sold for exhibitors and 1,500 participants. So IMTS is coming back. Trade shows are coming back. We are really excited to make use of this great studio. We broadcast live from IMTS and have for the last 14 years. So this takes it to another level. We'll be doing live broadcasting here, live broadcasting throughout the facility, and extending the reach of IMTS well beyond the 130,000 that we expect to attend in person. Maybe someday we'll get to that 150,000 mark. But trade shows are coming back. That is my message today. And thanks to the crew here, David, Larita, it's been a struggle, but we can see the light, and the light is coming soon. Thank you.
Thank you, Peter. I don't think we can say that enough. We're excited to be ready to open, but we're also great news to hear from our customers that not only they're ready, but their exhibitors are ready, their attendees are ready, and we're going to be doing some big events here this year and next. The last speaker that we have today is Steve Drew. Steve is the Assistant Executive Director of RSNA, which stands for the Radiological Society of North America. It's truly an international event. This is probably the largest imaging scientific gathering in the world. It meets here annually in the late part of the fourth quarter around December. And Steve, while this just to show you the capabilities of what we're talking about here in the studio, Steve is somewhere out in the hinterlands of Western Illinois, and he's going to join us right now. So I'm going to turn it over to Steve Drew.
Hey, good morning. Thanks to the ACT Hybrid Theater for providing me opportunity to meet with all of us participating here this morning. Very cool, nice system. I just say hats off and applause to Larita, Dave Costin and their teams, along with the mayors and governors' offices, and getting us back up and running in what we think is the greatest event city in this nation. Also, a special thanks to Freeman for this fantastic new theater that we're all experiencing here this morning. So first off, I'd just like to say RSNA considers Chicago its home. I've been with the RSNA for 32 years, and the upcoming annual meeting will be my 33rd consecutive meeting in Chicago. I'm happy to report that RSNA officially announced via its May 17th press release that all plans are underway for convening its 107th Scientific Assembly and Annual Meeting of McCormick Place, coming up November 28th through December 2nd this year. With that said, I'd like to share a few of the exciting highlights and indicators that we believe are positive proof of people's will for reconvening face-to-face in Chicago. RSNA received 10,400 scientific and educational abstracts for presentation this year. We believe that such a large number of submissions is testament to the overwhelming enthusiasm of presenters, faculty, and attendees to reconvene in Chicago at the world's largest radiology and medical imaging forum. We've heard from many of our regular attendees and exhibitors that they're excited and ready to get back to Chicago for the RSNA meeting, and we certainly look forward to welcoming them. Planning is underway for building a robust in-person scientific assembly and technical exhibition, along with our virtual meeting component that we've been convening for boy, I think we're going on 12 years now. So we've been in the virtual business for a while. And of course, hybrids means a lot of different things to a lot of people, but I guess you could say we're going to be including hybrid this year as well. It also gives all of our attendees the opportunity not only to participate remotely. We find that 80% of the people who actually sign up for our virtual access are in McCormick Place, and they're in the 43 consecutive meeting rooms taking place, multitasking, watching other multiple sessions taking place on their notebook and portable computers while sitting in a seat in any given presentation. So it's pretty interesting. This is a critical time for radiology professionals to develop responses to all the rapidly changing healthcare environment. In addition to the outstanding research and abundance of education, the meeting provides an opportunity to reconnect face-to-face with friends and colleagues and to share what they've all learned over the past 2 years. As the world's largest medical imaging conference, RSNA 2021 also provides the ultimate show floor for demonstrating the latest medical imaging technologies in CT, MRI, artificial intelligence, and 3D medical printing. There's been a strong interest in exhibiting, with over 470 companies reserving 331,000 net square feet of exhibit space at First Opportunity last month. So we couldn't be more pleased coming out of what we just all experienced to have that kind of participation. RSNA's virtual platform will provide access for individuals who are impacted by institutional, corporate, or national travel restrictions. The virtual meeting will feature 100% of all of our eligible meeting content. Virtual exhibitor opportunities are going to be available for those companies who cannot travel to Chicago. Companies exhibiting at McCormick Place will be provided expanded outreach through special opportunities to live stream from their booths to the virtual audience. RSNA's mission focuses on health and patient care. The primary consideration for RSNA 2021 is health and safety of all attendees, exhibitors, and staff. The Society is actively working with the city and McCormick Place to implement public health protocols and best practices to provide the safest possible meeting environment we can. At this time, specific health safety requirements for registrants are undetermined and will be considered, communicated, and if necessary, implemented in closer proximity to the opening of our event. So thanks for having me here this morning. Pleasure sharing some of this information with you, and I'll turn it back over to Larita and David.
Thank you, Steve. Thank you, Peter. Thank you all. We really appreciate it. As you can tell, we have so much positive momentum here on campus. The return of our loyal customers and our new customers beginning this new adventure with us means that McCormick Place will return to being an economic engine for both the city of Chicago and the state of Illinois. I'm really very proud of our team. We didn't take a single day of the last 14 months and let it go to waste. We assessed the needs on campus in a post-pandemic world and took this time to make updates throughout our campus. McCormick Place is set. We're set up to thrive in a post-pandemic world, and I, for one, am looking forward to greeting our customers. I'm looking forward to greeting our staff and all the people that make our wonderful facility work. I want to express my profound appreciation to every one of you that came out to this event today. I cannot express to you how great it feels to know that we are returning to business as usual. Thank you so much. And now we are happy to take any questions. All right. Well, that was easy. Well, thank you so much. And with that, we will conclude our event. Yeah.
But this is terrific. We just